Welcome back to Fix Your Relationships podcast. I'm Dr. Tiff, your host, and I am so excited to have you here today because we're talking about one of my favorite subjects, something that I've studied extensively, low sex desire or sexual desire, period. So we're going to be talking about sexual desire and specifically why your sexual desire might be low. So if you're a woman who has experienced low sexual desire or is experiencing low sexual desire, then you're going to want to pull up a seat. You might want to pour yourself a little something. Also take notes because you might want to talk to your doctor about some of this. But yes, today we're going to talk about low sexual desire, why it's low, really the real reason why it might be low, and also some things that you can do about it, okay? So if you are interested in learning a little bit more about your sexual desire, why it might be low, and what you can do, then I'm going to encourage you to just lean in, sis, lean in, because I got some goodies for you. Let's go. Hi, I'm Dr. Tiff, your relationship transformation coach. I've spent the past 20 years working with high-achieving women just like you who are crushing it in every area of their lives, everywhere except their relationships. And look, I get it. Finding the one ain't easy, and relationships are hard. But you know what's even harder? Cycling through the bad ones, or worse, staying in relationships when you already know they're not a good fit. You want a relationship of ease, uncomplicated, someone to love you down, but instead you've been suffering through bad dates, sexual incompatibility, and someone who might be good for somebody, but not for you. And if we're really being honest, you know that deep down, the work that really needs to be done starts and ends with you. If you're done wasting time in dead-end relationships and sick of looking for, chasing after, or trying to convince somebody to be the one, and you're ready to become the one, then baby, you're in the right place. So prop your feet and let's clink glasses because I'm giving you the tea and the tips to fix your relationships. Let's go. Hi there, it's me, Dr. Tiff, and I am your host for Fix Your Relationships podcast. I want to thank you guys so much for tuning in this week. I've had so much fun hosting the show, and I really hope that you guys are having a good time, that you're learning, and that you're getting some strategy and some tips on how you can fix different elements of your relationships. Today, I really want to talk to you guys about one of my favorite topics, sexual desire, and specifically the real reason why your sex desire might be low, if it is. Now, if you have listened to previous episodes, I have talked about sexual desire and some of the things, the questions that you should be asking if you think that your desire might be low. But if you have determined that your desire is low, I would imagine that you might want to know why. And so today's episode really is going to explore the why reasons why your sexual desire might be low, and hopefully give you some questions that you can then present to your doctor so that we can get to the bottom of this thing and figure out how to get it where you would like for it to be. So we're going to start first with defining low sex desire. I love a good definition. Okay. And this one is super simple. You could go to Webster's, you could go to wherever and, the internets and pick up different, definitions, but just to be as clear as possible and simplify it as much as I can, sexual desire in and of itself is your internal motivation to be sexual. That's it. My internal motivation to be sexual. So low sexual desire is when you have a low internal motivation. You don't really want to, okay? You're not feeling it. You're not motivated, okay? You know how sometimes I will say, excuse me, I don't know why at this moment my dog wants to put his head in my lap and make me rub his head. But alas, this is what we do as pet parents, right? All right. So I have had a love-hate relationship with working out. It's not really something I like to do. And I never have a desire to do that. I have a low workout desire. A low workout desire is what I have. I don't have very much internal motivation to work out. Okay. Some people have a high workout desire, okay? They are very much motivated by working out. They are always ready to go. For me, motivation comes after action. After I have worked out, then I'm like, I feel really great about it. I feel like, I'm glad I did it. Same with sex for some people. Like they may not have the desire, but once they're in it to win it, okay? And they really love it. So desire, that's the other thing I want to make sure that we don't confuse it with is we can't confuse low sexual desire with not enjoying sex. Those are two totally different things. Okay. You cannot have a desire for sex or sexual pleasure and certainly enjoy it. Let me say that again. You can have a low desire for sex or sexual pleasure. Right? You cannot crave it. You can, not be someone that's thinking about it all the time or wanting it, not motivated to initiate it. But it doesn't mean that you don't enjoy it when you're in it. A lot of people think that, I may not have a low sex desire because I actually do like it. But then again, I never really initiate. I don't really think about it at all. But if my husband taps me on my shoulder, I can do it. And I really like it. I have orgasms, all the things. But if we're thinking about like if I'm asked if I desire it, if I'm motivated to do it, if I'm thinking about it, I might rather take a nap. Okay. That's me having a low desire. Doesn't mean that I'm not into it when it's going on. Doesn't mean I don't like it. It just means that the desire is low. I hope that's clear. Plenty of women and men enjoy sex, but still have low sex desire. Okay. The other thing I want you to remember is something I've said before as well, is that the average American couple is having sex about once a week. It's important to think about what's low to you, okay? What's low to you and your partner, and not to compare it to other people or what you think the standard is or what you think is normal. Low sex desire or low sex drive or low motivation might look very differently from relationship to relationship. If you are someone who is used to and craves sex once, twice, 3 times a day, your desire is pretty high, okay? Compared to the average person. Okay. And so when we're comparing it to the average person, my desire is not low at all. If you're trying to do it every day, excuse me, your desire is high. Okay. My desire is not low. My desire is right where it should be. You the one. Okay. You're the one that's got a high desire. So we want to think about what's normal for our relationship and not what is like what we generally classify as low, because that's going to be different for everybody and different people have different standards on what's high, low, and normal. So what is normal in your relationship, and is it low for you as a couple? Is the desire low for you as a couple? Also, you might want to ask yourself if and this is kind of what I was hinting on before, if it's low or just lower than your partner's, because it could be that your partner is high, like that the desire is high for one of you and lower for the other, but it doesn't necessarily mean that clinically there's something wrong with either of you. It's just that, you have a desire, what we call a desire discrepancy. And that's just a fancy way of saying that your desires are different. You want different things, or the amount of sex that you crave or intimacy, physical intimacy that you crave is just different. There's a discrepancy, and we have to figure out a way to alleviate that gap a little bit. All right. So the question on the table today is like the why. Why is the sex desire low? So what I want to talk about now is just the reasons why your sex desire could be low. Now, none of what I'm telling you today, because I'm not a medical doctor, right? I'm not your sex therapist. And I'm certainly, if you haven't hired me, I'm not your coach. Although I do play your coach on this podcast. What we are looking for with low sexual desire is 3 things. I'm only looking at 3 things. And I'm looking for the biological, psychological, and social reasons why your desire might be low. And so let's figure out why it's low by looking at a biopsychosocial model for sexual desire, right? If someone comes in and says, my desire for sex is very, very low, not quite sure what I should be doing, not sure why it's low. These are the steps that I would take in order to kind of get you to where you need to be. And so you can use this information to get yourself where you need to be and to work with your own professional, your doctor, your therapist, your sex therapist, your GYN, whomever, so that we can like work some of these things out. Okay. So first, I'm looking at biological causes. Biological causes. So when I say biological causes for low sex desire, I'm thinking things like medications, right? Are there medications that you may be taking? Maybe you just started or you've been on for a while that could be causing your desire to be low. Is there an illness going on? Is there something going on that maybe from a medical or physical perspective has you a little preoccupied and just not really desiring sex? Here's one thing that I'm thinking about. Let's say you have sciatic nerve pain, back pain, knee pain, a groin injury, right? Those things may take precedence to your desire to be more sexual. Right? When you are in pain, your pain kind of takes priority. Your pain is usually front of mind. So you're not necessarily thinking about being sexual. Some people do. Some people can, be broke down, but still ready to go. That may be you, may not be you, but that could be a cause, right? Something biological like that. We also want to look at hormones. If you are a woman of a certain age, knocking on menopause's door, or maybe even not. But as we age, we certainly have hormonal changes. During pregnancy and postpartum, we have hormonal changes. And so with those hormonal changes, we may feel less motivated to be sexual. We may not be thinking about it as maybe we once were. Okay. With hormonal changes, and this is kind of a twofer, with hormonal changes sometimes comes vaginal dryness. With vaginal dryness comes pain and discomfort with sex. And if sex is painful or not comfortable, a lot of people don't want to continue to do it. So that could be a problem and a cause for your lack of motivation to be sexual, right? So I want you to think about different medications that you might be on and when you notice a lower desire. I want you to think about any illnesses or anything that you're going through physically. I want you to think about your hormone levels and where you are in that stage. I want you to think about any kind of pain or anything that may be going on with you medically that could be causing your sexual desire to be low. And if things come up for you, if you're like, it could be this, then I need you to talk to your doctor about it and let your doctor know how these things are impacting your sexual health. A lot of times doctors don't necessarily ask the pointed questions about how these things are impacting you sexually. And so we have to be our own best advocates and make sure that we are volunteering this information, especially if it's something that is bothering you and that you want to improve. They don't know that there is a sexual side effect until you tell them that you're having a sexual side effect, okay? And it could be that sometimes something is a sexual side effect of a medication or, an illness or whatever. And sometimes, your doctor may say, well, you know what, you're going to have to lay off this particular position for a while because your sciatic pain ain't going to go away when you're doing that. Or you may find that a different position may alleviate the pain. So it's important to talk about these things with your physician so that they can help you get a workaround, especially if it's like a medical issue or a medication issue, because some medications do have sexual side effects, and it may be something as simple as changing your medication, right? So talk to your doctor, okay? That's how you work through that one. The next one is psychological reasons for low sex desire. How many of you have ever just been exhausted? Maybe you've had long days and nights. For me, you guys know that some of the work that I do is as an intimacy coordinator. And because of that, there are times that I've had to work overnights, several nights in a row, because we had just at nighttime shoots and we had to shoot outside or something like that. So I miss bedtime, okay, with my husband. We're on two different ships passing in the night. But because of that, sometimes I'm just super tired when I've had back-to-back sessions like that. And, I also have an autoimmune disorder. So medical, right? The biological stuff. If I'm having a flare-up, let's just go back to that right quick. If I'm having a flare-up, with my sarcoidosis, I may be super exhausted and tired and just not like sex is just not a priority for me. It's not a front of mind. And so I just may not be thinking about it. Okay. It's legit an issue. So that might be a biological or physiological thing that's going on for me. But because of the fatigue, maybe because of lack of sleep, other things, maybe it's anxiety, maybe it's depression, maybe it's past trauma, maybe it's my OCD, lack of focus, inability to focus, right? It could be so many psychological things that are going on that can cause us to not be present and or not desire to be intimate. Okay. And if you're recognizing that, wow, did not realize there was a connection between, my OCD or inability to let go of things or my lack of focus and my ADHD, like my brain is going 15 miles an hour, that I just never even think about sex. These are real things. And these are things that we can address, right, in individual therapy. So if you're recognizing that, hey, perhaps some of my mental health stuff could be impacting why I don't want to have sex, then I'm going to encourage you to seek out mental health treatment. It could be situational. It could be, short term, just to figure out, some things that are going on. Or it may be that this is something that's ongoing for me and I really just need to address these issues. Either way, I'm going to encourage you to seek out the help of a therapist to help you through some of those things. Like I said before, sometimes we find that low sex desire and even some of our sexual dysfunctions are a symptom of another problem. Of another problem that sometimes it's not just a one-off and a one and done. It's just low. Sometimes it's a symptom. There's a cause for it. So we reviewed some biological causes. We reviewed some psychological causes. The last is the social causes, and social are more of the relationship problems. Okay, here we go. So if you are having issues in your relationship, if you don't like your partner, if the communication is ass, if it's horrible, if you're fighting all the time, if you feel like you're getting taken advantage of in your relationship, you don't have a bandwidth for anything else, if you sick and tired of this person up in your face, if he don't want to brush his teeth, if he don't help out around the house, if you are just not into this person, maybe they're abusive, maybe they're disrespectful, maybe you guys are just incompatible, right? If that's the case, it makes sense that you might not want to have sex with them or might not be motivated to be sexual with them, right? That makes sense. And because it makes sense, I want to tell you something. Your desire is not broken. Your desire is actually working exactly how it's supposed to. Again, remember I told you that this could be a symptom of another problem, right? If you've got some relationship issues going on, if you've got a partner who, let's say, for lack of a better example, treats you like trash, isn't very nice to you, talks down to you, argues with you all the time, is nitpicky, tells you, how horrible you are or how bad of a mother you are, or always is asking you to do things that are just unreasonable. You tell me, why would you want to have sex with him? Why would you be motivated to do that? It makes sense, right? But until we fix those relationship issues, you're still going to feel that way. So we have to figure out the cause and then what we need to do. And what we need to do in this case, if it is a relationship issue, if, you're incompatible, you don't like the person, even if there's a sexual incompatibility, maybe you love the person, but the things that they're doing in the bedroom are not getting it for you. And you would rather do it yourself or not do it at all. Then we got to fix that too. So in terms of fixing that, I want you to see a couples therapist or a sex therapist. Okay. I think that is a great solution in helping you to repair what's going on in the relationship if it's more of a social or relationship issue. Okay? So, first and foremost, if you're noticing that your sexual desire is low, I don't want you to confuse it with not enjoying sex, because sexual pleasure and sexual desire are different things. Desire is coming before, pleasure is coming during, okay? Desire you can think about well in advance of actually having sex, all right? And it's your motivation to be sexual. How motivated are you to do the things, okay? and understanding, that you don't necessarily, when you're talking about low sex desire, we don't need to compare it to anyone else. We just need to look at the norms for our relationship and what we're comfortable with. And really asking yourself, if your desire is low, like, is it really truly low? Or is it just lower than your partner's? Because it could be that your partner is higher than you or a high desire partner, okay? Give yourself some grace, give your partner some grace, and let's figure it out, right? Let's figure out the why. The why being biopsychosocial reasons. Maybe it's biological or physical. It could be psychological, could be something going on from an emotional, mental health perspective, and it could also be relational, right? It could be something going on between the two of you. If you happen to experience low sexual desire, I hope that you have found this information helpful, that you've gotten some clarity on the why, what could possibly be causing it, and you also have a little bit of direction as to where you need to go in order to get the help that you need in order to level things out for yourself and for your relationships, okay? And if you are someone who's been struggling with low sexual desire and you're finding that it's impacting your relationship, I really do want to help you if I can. So email me at support@drtiffanyhenry.com. Ask your questions because I promise you, if you have a question, somebody else has a question too. And I'd love, love, love to answer that. Also, if you know of a good girlfriend, if you got a good girlfriend, you're good Judy, okay? You're good Betty. That's my mama's name. If you got a good girlfriend who may be experiencing low sexual desire, could care less about it, okay? Maybe want to have sex, but just, who got that kind of time? If you got a good girlfriend with low sex desire and you know it, how about sending them this episode? Share the episode with them because it may give them some insight into what's going on with them and give them some clarity as to what their next steps should be. And if you need help navigating this and other relationships, I want to help you. I have a few openings this month for one-on-one coaching, and I'd love to see you meet and exceed your relationship goals. So if you want to set up a 15-minute coffee chat so we can figure out if one-on-one coaching is right for you, I'm open to it. I will put a link down below in the show notes, but also you can just email me at support@drtiffanyhenry.com. Tiffany is spelled Tiffanie. So support@drtiffanyhenry.com, or just tap the link in the show notes, okay? I hope this episode has been helpful for you and that you have gotten what you needed from me and from this content. I thank you so much for tuning in to Fix Your Relationships podcast. I'm Dr. Tiff, and I will see you next week. Bye. Hey, babe, I hope you enjoyed today's episode. My goal with this podcast is to bless you with information that helps you fix those relationships that are most important to you, but not before you do the self-work needed to make sure that those relationships thrive. If this episode was exactly what you needed, then guess what? Somebody else probably needs it too. So do me and them a favor. Please share this episode with your good girlfriend and let her know about the podcast. And while you're at it, hop on over to Apple Podcasts and leave a review. This really helps to grow the podcast and puts it right in front of other women who are desperate to work on their relationships and themselves. And if you haven't done so already, I want to invite you to join our community of like-minded women all on a journey to become the one. You can sign up for free at becometheone.myflowdesk.com/email. I know that's a lot, so just go on over to the show notes and click that link there. Thanks again for listening to Fix Your Relationships with Dr. Tiff. I'll see you right back here next week.